Hi guys, Dr. Lavan. So this video is just a follow-up from our recent visit at Julian's house, who, if you remember, he was our expert patient who recently had knee replacement surgery. He's actually going to show us a couple of life hacks now, which is actually really useful for other people who are going through not only knee surgery, but a concept that can be applied for other surgeries. So I guess it'd be a really nice time now to talk about a couple of hacks post-operatively. That will be nice to maybe talk about, because getting access to some of this knowledge is very, very difficult, and in the nicest way you're living through it now, so you can tell us how it's been a benefit. So what about one of the first hacks you kind of decided?
Yeah, well, I learned this on another operation. Very, 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 very importantly, you must not get DVT, deep vein thrombosis. You must wear the stockings that they tell you to wear, despite them being very ugly and uncomfortable. But you will find that they will itch like crazy. Simply, all I did was shave my legs, and all the itching went away. And I've had them on for, 8 days, I think, something like that now. So that's the most important thing. But with that, I would say, don't shave them before the operation, because you do not want cuts and ergo the infection. Shave them afterwards and use a beard trimmer, so you're just shaving them down to 0.5 millimetre.
Great.
So you're not actually scoring the skin
Good.
at all. But I promise you, you shave your legs down there. I know it's a bit weird if you're a hairy man, but it's worth every ounce of effort. So that was
Good.
a big hack for me.
Yeah, good.
It drives you crazy.
And it's really important, because a lot of the time our patients do come and say, look, can I take it off in the daytime? I'll just wear it at night. And the key is, if we can keep it on as long as possible throughout that time, that risk that Julian was talking about, a really, really key one, because sadly it can lead to life-threatening complications, is very important. So thank you for that hack, Julian. And the other one is about swelling and trying to reduce swelling down. And I know typically the doctors will say, I'll just put a bit of ice on that. But what have you learned from people that can help?
Well, you kind of know when it's time to put the ice on, because it just feels stretched and sore, and the heat that comes off your knee is amazing. I use a cryo cuff that was, they're about sort of £60 in the UK, but I was fortunate enough to have a friend who lent me this. It's just a bucket. Yeah. You open it up, you put in some ice and some cold water if you have, and you hold it above the actual knee pack that you put around your knee. Just secure that. Just put your leg up and relax. Wow. And then what happens? This gets warm. Yeah. You do that. Right. It drains back in here. You give it a shake.
Oh wow.
You do that.
Wonderful.
And you do that 3 or 4 times, but after that the water will have gone warm. But by that time your leg will be really cold, and it feels kind of nice. And it's been great for keeping the swelling down. But now, so I'm 8 days out, I think, and I'm not really using it that much actually. So, which is amazing.
Great. Oh, thank you so much.
Keep on top of swelling, definitely.
Good. So that's a great hack that, even I have to be honest, I wouldn't advise. I would have normally just put ice on, but I think it's good to keep it focused. And I think the main point of all of this is, if we can do everything maximally pre-operatively, and actually even the first week or 2 after, the success of this joint will be wonderful for later. And you look like you're doing brilliant with it.